This morning, 15,000 New York City nurses hitting the picket line in what is considered the largest nurses' strike in the city's history.
Nurses, united! We'll never be defeated!
Union members walking out of several private hospitals across the city at 6 this morning.
We need fair contracts now because I know that people are going to suffer, and that is not what we want.
In response, hospitals like Mount Sinai say they have hired more than 1,000 agency nurses to help combat disruptions to care.
The important, I think, piece to be mindful of is that we have spent lots and lots of time bringing in additional support to make sure that the responsible care of patients remains a priority.
Nurses say they are seeking.
If you really thought that that the care of patients were your top priority, you would prevent this. You would have prevented nurses going on strikes. Like, I don't understand how a person can come on TV or, just look on a Zoom or something and spew that bullshit. Like, let's be honest. If you gave a damn about patients, you would make sure that the nurses that serve them, that make sure that they are there working with 40, 50, possibly close to 100 patients a night, making sure that those nurses are good. Like, it all comes down to money. Now, of course, people might say, well, some of these hospitals, their margins are so thin. Come on now. Come on. If that's what you have to go with, then you need to also talk about the insurance companies that make their margins so thin by not wanting to pay out what they should pay out. Nurses are on the front line, all right? And they see a lot, and they deserve to get paid very good. Now, the average pay for nurses in New York City is between starting pay is like 80-something thousand to maybe even 100,000, depending on where you're working, if you're working in the ICU or different parts of the building or different parts of the hospital. So, yes, they make good money, but New York is very expensive, and they deserve more. And if you feel that way, put in the comment section. If you feel that they deserve more, put in the comment section. If you feel they don't, put in the comment section. I would greatly like to hear from you. Let's get back to it.
Better staffing ratios, protection of benefits, pay increases, and workplace security guarantees, with the union pointing to recent shootings at city hospitals.
Right now, working as a nurse in a hospital, you are danger everywhere.
On Friday, the governor of New York, Kathy Hochul, declaring a state of emergency. This morning, saying she's happy 11 hospital systems have reached agreements, and she's sending New York Department of Health staff to the 3 striking hospital systems to monitor and ensure patient safety. All of this comes as flu numbers across the country are reaching record levels. 41 states, including New York, are seeing high or very high flu activity.
The healthcare system will be there to make sure that people's needs are met.
For the millions of people here in New York City, patient care should not be affected, so the hospitals say people should not delay or avoid getting help in a medical emergency, George.
Yeah, that's obvious. If you need a medical emergency, call 911, okay? That's obvious. They have different networks. They have city hospitals like Kings County. They have public hospitals like Brooklyn Hospital and stuff like that. So and I'm just talking about in Brooklyn, all over the 5 boroughs they have those. But they have been closing hospitals. They have been closing hospitals because, lack of money and stuff like that. But still, my wonderful brothers and sisters who are nurses in New York City, they need to make extra money. Now, of course, they make extra money by doing certain things, night differential or different types of specialities, and so they make extra money and stuff. But come on, we have to be humans for just once and start understanding that people have value. People are working hard. People are trying their best to make a living, and to take care of people who need them at their most vulnerable situation. So why not? Why not make that they are able to do what needs to be done and make some money? Like I look at right now, let's go to Google real quick and look at the starting salary of a New York City nurse. And it says here, and this is an AI overview, a starting salary for a new graduate registered nurse RN in New York City typically ranges from the high 80,000s to over 100,000 annually, with averages often cited around 88,000 to 90,000 base pay, but total compensation can reach 117,000 or more with differentials, night shift specialities, depending heavily on the hospital unit like ICU or Med Surg and union contracts. For example, major hospital systems recently negotiated salaries, putting average base pay significantly higher, with some entry-level offers, including shifts, reaching into the 90K plus range. And that's good. That's good. They deserve to get paid that. And of course, people say, well, you know, the overtime and stuff like that. Yes, but it is a highly demanding job. Highly demanding job. And they deserve to get paid well. So I am all for it. I'm all for them doing what they got to do, striking and making moves, okay, and so that they can get these hospitals to pay them right and to acknowledge them as a human being, acknowledge that, hey, they need to take care of themselves. They need proper health coverage and stuff like that so that things can be done and they can get back to work, making sure that New York's sick, vulnerable, and people who get injured and go to the hospital, that they can get the care that they need, the love that they need, and to make sure that they are feeling appreciated and feeling wanted to be able to live in this city. Well, my brothers and sisters, thank you so much for watching. Really appreciate it. I know your time is valuable when you spend it with me. Thank you so much. If you haven't already, please like, comment, subscribe. All that good stuff will help us out continue to grow on this YouTube platform. Thank you for watching. Be safe. Have a wonderful, wonderful day. Peace.